My dearest ladies and gentlemen of this University of Excellence, through the introductory speech I delivered to you earlier on, you now have a profound idea, view, knowledge, and/or insight into our exploration of the course Medical Entomology, with special emphasis on its role in local, national, continental, and global public health. In this course, students are expected and required to take note of the fact that this course is intended to provide students with an in-depth knowledge and understanding of the field of medical entomology, focusing on the role of the member species of the phylum Arthropoda in transmitting various diseases affecting humans around the globe, and most especially on the continent of Africa. It encompasses the biology, ecology, control, and/or prevention of disease vector species, emphasizing the epidemiology and prevention of vector-borne diseases. Each student is expected and required to have the opportunity or the privilege to explore the impact of these diseases on public health, with special attention to tropical regions such as the Republic of Ghana, Uganda, Ethiopia, Federal Republic of Nigeria, Democratic Republic of the Congo or DRC, and so on and so forth. The specific objectives are such that by the end of the course, students should be able to 1. Identify key arthropod vectors of human diseases. 2. Understand the biology and ecology of medically significant arthropods. 3. Explain the mechanisms of disease transmission by vectors. 4. Assess the epidemiological significance of vector-borne diseases. 5. Develop and evaluate strategies for controlling and preventing vector-borne diseases. And 6. Analyze the impact of vector-borne diseases on public health systems, particularly in tropical regions. The course contents include 1. Introduction to medical entomology, which includes exploration of the definition and scope of the field of medical entomology, its historical perspectives and significance in public health, and therefore an overview of arthropods of medical importance. 2. Arthropod biology and ecology, which covers the general biology of arthropods, their kind of life cycle and reproduction, as well as the ecology of vectors with special focus on their habitat, behavior, and population dynamics. 3. Vector biology and disease transmission, which encompasses the mechanisms of disease transmission, namely the biological mechanisms of transmission as associated with malaria and dengue, for example, and mechanical mechanisms of transmission of diseases as described for trachoma. Number 4, important vector-borne diseases with focus on A. Mosquito-borne diseases such as malaria, Zika, yellow fever, chikungunya, and dengue. B. Fly-borne diseases such as onchocerciasis and sleeping sickness. C. Tick-borne diseases such as Lyme disease and rickettsial infections. D. Flea-borne diseases such as plague. And E. Mite-borne diseases such as scrub typhus. Number 5. Epidemiology of vector-borne diseases. This part is expected and required to include the epidemiological concepts and principles in the field of medical entomology, disease surveillance and reporting, as well as the role of climate and environment in vector distribution. Number 6. Case studies with emphasis on malaria, dengue, and Zika virus in Ghana and sub-Saharan Africa. 7. Control and prevention of vector-borne diseases. These contents cover A. Integrated vector management, IVM. B. environmental management and habitat control. C. Chemical control using insecticides and their associated challenges such as insecticide resistance. D. Biological control methods such as the use of natural predators and pathogens. And E. Personal protection methods such as bird net, repellent, and clothing. Number 8. Public health interventions and policy, including those related to vaccination and chemoprophylaxis, community participation in vector-borne disease control and prevention projects or programs, and related education. Such policies include international and national policies on vector control. Number 9. Emerging issues in medical entomology. This is expected and required to include emerging and re-emerging vector-borne diseases, as well as challenges in vector control and prevention, in addition to the impact of globalization and climate change on vector-borne diseases. Number 10. Advances in research and technology like genetic control of vector species. And number 11. Case studies and practical applications. Here, the course is expected and required to include insectry or laboratory identification of key disease vectors, field studies or research works such as vector surveillance and data collection techniques, analysis of vector-borne disease outbreaks, control and prevention strategies, and finally, application of Geographic Information System, GIS, in vector mapping. On the expected and required mode of delivery of this course, students should note that the mode of delivery of this course will include the traditional in-class, in-person methods, as well as audiovisual presentations and e-learning modes whenever it is appropriate. The mode of delivery expected and required for this course also include some on-ground and oral lecture presentations, PowerPoint presentations, class discussions, and a variety of group activities. In the next lecture, I will present to you the kind of plan that I have been able to craft out of the course objectives and these contents as provided by the department to enable students to enjoy the exploration of the course as much as it is possible. Students are expected and required to present their comments, questions, and suggestions for consideration and discussions. May God bless the expectation of each student of this course, including you. I am Daniel Hayford. Thank you for being part of this lecture. Bye.